A lot of people have a problem falling pregnant, and definitely there can be a lot of reasons why this happens, but one could be that their toxicity level is high. Definitely 3 months before pregnancy, I'd suggest completing a detox. Get that body into tip-top condition, reduce those toxicity levels. It'll be a nicer environment for your baby to grow in. The other thing that we've found as well is it helps to clear some of those excess hormone levels, like excess bad estrogen, that can cause really bad morning sickness while you're pregnant. So doing a detox before conception can help to prevent nasty morning sickness in a lot of people. You have to be very careful taking these kind of products, because we definitely do not recommend detoxing during pregnancy. So 3 months before pregnancy or before considering conceiving, consider doing a detox. The one that I go for, that I usually recommend, is the Malcolm Harker product, OSR. I love this product. It's made here in New Zealand, made up in Waipu by master herbalist Malcolm Harker. This is a lovely, gentle, but very effective detoxer. It'd be great for both you and your partner to consider taking this. If you happen to fall pregnant while you are taking it, just stop taking it straight away. Liquids don't always taste that great, but the beauty of it is you can start with just a small amount and gradually increase up to the recommended dosage, which would be 10 mils 3 times a day. So OSR. Now remember, whenever we do any kind of detox of any sort, it's always important to take your probiotic afterwards. I like the Inner Health, and you can get it in a 1 month supply, and 1 month supply is enough to do after any kind of detox at just 1 a day. So the Inner Health Plus once you've finished your detox. What about our hormonal balance as a woman? Our hormones really need to be in the right balance for us to be able to conceive easily. A lot of women have a problem. It could be that they're not trying to conceive on the right day in their cycle. And would you believe that you're only fertile for about 36 hours a month? So it's not a very big window to try and fall pregnant in. You have to know exactly when are you ovulating, when are you fertile. How do we know? Well, at Ideal Health we have something to make it very easy for you, and that is this wonderful fertility testing device. It's a saliva ovulation tester called Maybe Baby. I love this product. I recommend it to every woman who is trying to conceive. I like this because it's very simple to use. It's a little microscope, proper little microscope, and what you do is you use your mouth saliva. Each morning you wipe some of your saliva onto the screen, then have a look, wait for it to dry, have a look through the little microscope window, and when you are getting close to ovulation, the pattern changes. It's very, very obvious. And on the back here it shows us a picture of what it looks like when we are not fertile, and then what it looks like during our fertile period. So the beauty of this product here is that we can use it any time. It's not a throwaway. Once you've got it forever. And it gives you a window of about 2 or 3 days as to when you will be fertile, so that you can plan your conception. Fantastic, Maybe Babies. It takes the guesswork out. But what if you're still not conceiving? What if you're still not getting pregnant? It may be that you have a hormonal imbalance that needs to be evaluated. So one way that you can do this, of course you can go to your doctor, and your doctor may be able to help you. But here at Ideal Health we have hormone testing kits, so that you can work out exactly where are your hormones at. How high or low are these? And this is it here. It's the female hormone test. This is a test kit. All it is your proof of purchase and the instructions and a little saliva vial. How you use this is you collect your saliva on a particular day in your cycle, pop it in the prepaid envelope, send it off. It comes to here, comes to us here at Ideal Health, and I send it off to PathLab in Australia. At PathLab they test your hormones, and they test three main hormones: your testosterone level, your estradiol or E2, estrogen, and your progesterone levels. We do the test on day 21 of our cycle, day 1 being the first day of true bleeding. So from there we count another 20 days, and on day 21 this is the day that we do the hormone test. Wake up in the morning, rinse our mouth out, and then spend the next 30 to 40 minutes collecting all of the new saliva. Then we send it off, and it takes about 3 to 4 weeks for the test results to come back, but it definitely gives us a good idea of exactly what your existing hormonal status is like. Whether or not you've got too high levels of estrogen, which is a common contributor to women miscarrying. If the results reveal that you do have a hormonal imbalance, then that's something that we could help you to work at correcting. Depending on what the test results reveal, depends on what we would use, but there's a lot of different products out there that you can use. Okay, so the next thing is our diet. Now remember that everything that you eat and drink and ingest really is going to affect your baby. So you want to clean your diet up as fast as you possibly can. You want to get rid of all the junk food, tea, coffee, alcohol, cigarettes, any of those bad habits that you've got. You want to start eating a lot of fresh fruit and vegetables, salads, whole grains, nuts and seeds, lean meat, fish. This is an excellent reproductive guideline that we have from the expert Francesca Nash, and I'd be happy to provide anybody with this if you just like to. We'll put a link so that people can print this off themselves. But this is an excellent guideline and just talks about the ideal foods to avoid in your diet, the ones to increase, and one of the other things that Francesca really promotes is the use of organics, trying to choose spray-free or organic fruits and vegetables and meats and dairy products. Really important. If you are having a problem with your fertility levels, having a chart like this so that you can actually mark exactly what's happening in your cycle may give you a better idea as to when you are ovulating, so that you better know when you can try to conceive. Again, this is something that we'll put a link to, so that if you would like to print off your own chart, you can do that, and I'll pop instructions there as to how to use it and what to look for. This one is a temperature test, but as well as that, you could test for vaginal mucus as well. Okay. So once you are pregnant, then it's very important to continue with your supplements. Supplements need to be taken throughout pregnancy and also while you're breastfeeding as well. In fact, your nutritional needs are as high during pregnancy as they are while you are breastfeeding. The supplements that I've gone over today, these are the ones that I also recommend during breastfeeding as well.